Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a wonderful start to your day. And we love when you can say hello and come on. So let's hold on for a minute here and say hello to our dear friends as we do a little bit of a roll call in the morning. It's always fun. Okay, who's going to be number one here this morning? On my hit parade, it's Andrea from Niagara Falls. Lucille, you're right in that top group, and so are you, Nativity. Rosalinda, Niagara Falls. Nice to have you on. Thanks for coming. Sandy from Fergus Falls, Minnesota. Leela from Verner. And Sandy from Chilliwack, British Columbia. Kevin, there he is from Oshawa. Lisa, good morning to you. And Diane, how are you from Peterborough? Karen from Innisfil. Nick, how are you? Judy, New Brunswick. Brahim, our dear friend from Portland, Oregon. Bonnie, Blindheim. And Maureen, there she is, from Boca Raton, Florida. Georgie is from Halifax, Nova Scotia. I know a lot of places where you guys are from. And St. Catharines, Ontario. Rain, how are you? Rain Clouds on from Michigan. Wendy from Aylmer. Karen's on with us from Coldwater, Ontario. Dennis, how is you? And Donna from Belle Hubert. Nice to have you. Bruno, North Bay, Ontario. Darlene, Etta, and Helga and Dave from Scarborough. Sherry is from Mississauga. Franz from Orangeville. Grace is from the Rock, Newfoundland. Cecilia, how is you? From Shediac, Nouveau Brunswick. Carol's on from West Virginia. I want to sing so badly. Patricia, Florida. Cindy, Denise, Oakville. Sharon, Kansas. Flowers are starting to bloom. Patricia, how is you? Francis from Bon Cheryl, from Lighthouse Cove. Lynn, Aurora. Rhoda, Labrador. Wendy from Markham. Wanda, Virginia. Oh, I love those folks. Darlene, Saskatchewan. How are you, Darlene? Gwen, Bev from Saskatchewan. Deb, there she is, from Timmins, Ontario. Cheryl, I missed you, did I? Claudette, how are you? Catherine, Springdale, Newfoundland. Janine, how are you? And we love you guys. Come. Hi, Gary. Luella, there she is. I can even put a face to Luella from West Tennessee. Yolande. And Patricia from Pulaski, Tennessee. And Kristen. Okay, should we get going on our questions? Dahai. Laurie. Janice. And Carrie from Nebraska. Diane, good morning. I hate to miss anyone, but hi, Marcy. From Houston. Pam. And Linda. Oh, Linda's. Oh, those Lindas. Sue. How are you, Sue? From Bolton. Okay, let's get going. Q&A. Q&A. Why? Because we didn't get all the questions in on Friday. So we're doing another Q&A. Cheryl is asking a question. Can you tell me if following the reset, it helps with hair loss in males? Yes, it helps. I'll tell you why. Okay? And we got hundreds of testimonies where it has helped men. No magic. There's no magic to hair. Okay? Men, it's much more common for a man to lose their hair than a woman. A woman, no. There's nothing ever normal about a woman losing hair. It's not normal. I mean, I guess when you're 80 years old, you're going to thin out. Okay. But it's never normal. Okay. If a woman starts losing her hair, it's called hormones. Okay? Now, there's an autoimmune disorder too, alopecia. Now, in a male, it's a different puppy because men lose their hair, including me. Okay? I look at pictures when I was younger. Man, I had a lot of hair. Where did that go? Okay? So it's not unusual. Okay? I think that's a song. It's not unusual for a man to lose hair. So let's start off with saying, number one, that. Number two, hair is protein. If you take a strand, okay, of hair, analyze it, it's about 90% or more protein. So that ought to give us a clue. And one of the reasons the reset actually helps is because protein is the king of the castle, and it should be all the time when you're eating. When you look at macros, protein, fat, carbohydrates, those are called macros. What I try and teach, and I've been teaching this for years, is protein is the king of the castle, and carbs are the dirty rascals. Now, I'm not saying you can never have carbs, okay? So, like we understand that if you're going to have carbs, try and have them mostly from the plant kingdom. There's the animal kingdom, there's the plant kingdom, and there's man's kingdom of food, which is processed, made with bad oils, sugar added, big time. That's man-made food. Okay? So that's how I divide food. And your hair is protein. Now, in nature, God gave us protein with fat. Okay? Protein with fat. So, you have eggs. Are they good for your hair? Yeah, because they got all the vitamins too. You got all your B vitamins. You got protein, saturated protein, and saturated fat, which is good for your hair. It's good for everything. It's good for your skin, your nails. Okay? You need that. A lot of people, they don't realize they don't get near enough protein and fat in their diet. Your body was designed for it. You need to replace it. And protein, you need amino acids for your building blocks. Okay? So, yes, the reset helps because you're elevating your protein and fat levels. You're elevating testosterone for men. When you eat a steak, your testosterone goes up. Okay? And you need vitamin D too for testosterone. Sit in the sun. Elevate your testosterone, men. So, yes. And listen, another thing is, when you're doing the reset, you're detoxing. That helps. That helps hair. You're stimulating your thyroid. That helps hair. A lot of times, especially in women, they lose their hair and they got too much estrogen and their thyroid has slowed to a crawl. Or they have hair in the wrong places. When I went to get my hair cut the other day, it was kind of funny because the hairstylist said, you want me to cut some of the hairs from your ears and your eyebrows? I said, yeah, see, you get old and hair grows, but in the wrong places. What do I want hair in my ears for? What do I want hair sticking out on my eyebrows for? Take them off. I want hair on the top of my head. But yes, it's a good question. It helps. Is it everything with hair? No. Okay, it's not. But, okay, It's not, but I really like the reset because a lot of testimonies come in where they found their hair. And one thing I love for hair too, by the way, guys, is bone broth. It's really good for thickening up the hair because of collagen. Okay, people think of collagen just for skin, but collagen is very good for your hair, and bone broth is the best collagen. Okay? So, yes, good question. Thank you for it. And that was Cheryl. Stephanie is asking a question. Okay. Let me just get it in my head before I answer anything here. Okay. So she's been off and on the reset. Okay, Stephanie? Smart girl. You're eating right. Okay? You're eating right. Number one, when it comes to your health, number one, eat right. Eat the way your body was designed. Major on protein. Minor on carbohydrates. Okay? Major on protein, minor on carbohydrates. When you're doing the reset, you're not doing any carbs, but there's a reason for that. There's a reason for that. And it's 30 days. And some people go way beyond that. Okay? Way beyond that. And that's all right. I got no issue with it. But for the vast majority of people, they're going to eat carbohydrates. Okay. Eat the right kind. So, she's been on the reset, Stephanie, okay? And then she lost weight, she felt great, and she used to take bioidentical hormones, okay? Progesterone. And she now seems to be gaining weight, okay? Could this be hormone? Guaranteed. Okay? Guaranteed. Steph, I'm going to take out my little chart that I took out 10,000 times. No, more. Okay? When you first visited my clinic, I did this. I had a chart, a pyramid. I took out the pyramid and I said, I want to teach you in a very short lesson, Hormones 101. Okay? And I take out my chart and there'd be a pyramid. Okay? And on the pyramid, I put everything in there of hormones. And they're all connected. What? Yeah, they're all connected. Said you have to understand this. You're not going to get taught this anywhere else. Women. I'm looking at you. Look at me. Look at the chart. Okay? Because you don't have to have a PhD to get this right. But I want to give you a basic understanding of how your hormones work. And when they don't work, we call them hormones. And man, oh man, do we ever see a lot of that. Everything is connected. Okay? So then I take the chart out and I go, at the top is your thyroid. The thyroid's a puppet. It's connected to everything else. Doctors, unfortunately, isolate it. They look at numbers. They've been hijacked by the labs. Okay? They're hijacked. The vast majority of them. So they don't look at other things. They just look at your TSH or your T3 or T4. They look at all that stuff, and that's all right. I don't mind them looking at it. I look at it. But that's not the point. The point is you better figure out that everything else is attached to it. And that's why I would draw. You got two circles here, and those are your adrenals. Cortisol. Does that have a big effect? Because listen, I'm just going to read something that I just read, okay? In Stephanie's question. 10 minutes. I have had bouts of anxiety that just came from nowhere. There's a clue. Anxiety. Come out of nowhere. What happened? Well, that comes out of your adrenals. That's cortisol. Okay? That cortisol will slow your thyroid, which is your gas pedal in your car. Cortisol robs progesterone. It slows your thyroid down. See, I've got those other two circles down here. Okay, what are those circles? Your ovaries, ladies. And I got a little one in the middle there for the man, okay, the testes. But this is really important, guys, especially in women, because they can get into a hormonal storm because the thyroid's not working properly, and it might not show up in numbers. Your cortisol is high, usually. With this, you get anxiety coming out of nowhere. You're gaining weight. You look at food sideways and you're gaining weight. Your progesterone goes down, so what happens? Estrogen is dominant. I understand you're getting older. No, my estrogen's going down, doc. I know. But, and this is a big but, in comparison to your progesterone, it's unbalanced. You have estrogen dominance. What does that do? It messes up your thyroid. Okay? Really important. Now, here, let me show you something again. Because in the pyramid, I would draw the middle circle. Right there. Okay? The middle circle in the pyramid. And that was your insulin. That's food. Now, mind you, stress hormone, cortisol, independent of food, can make you insulin resistant. Okay? So here's Stephanie. She's eating good, and yet she's gaining weight. Hello? Yep. You're in a metabolic storm. Some go into category 5. They're so messed up. They're so unwell. And I hate to say it, most doctors miss it. That's why I was so busy. There could have been 10 of me in my practice. Okay? There could have been 10 of me. And because there were so many thousands of women that were falling through the cracks and nobody put their finger on it. And, what does diet have to do with hormones? Everything. Because insulin is involved in that pyramid. So, Steph, that's you. Okay? That's you. So, you got to do all of the above. Okay? And don't blame yourself. This isn't what you did. It's you. It's your hormones. They're not balanced. And everything gets affected by that. Okay? But don't get discouraged, Stephanie. Don't get discouraged. Just by eating right, you're on the right track. Big time. Elevate your progesterone. It's not going to happen overnight, but you keep at it. Make sure you're getting enough protein in your diet. I could put a circle here, okay? Because on this side here is your liver. And your liver is very much affected. Because first of all, that is where T4 gets converted to T3, which your thyroid needs to operate. A lot of people, they have fatty liver. I'm not saying you, Steph. I'm just telling you. A lot of people, their liver is all gummed up with fat. And that affects their thyroid. And no one ever tells them that. because they're not taught that. Okay. So don't give up. You're on the right track. Hit all of the above. That was Stephanie. Ruth is asking, is there danger in reheating food? Well, look, when you microwave it, okay, you're zapping those enzymes and things that help food to be absorbed and assimilated in the body, okay? So, in a perfect world, yeah, you're not really reheating food, but come on, Ruth. Well, no. Well, your name is there, so I'm going to say, look, again, understand where I come from. I speak in generalities, not on Q&A, but I got to give you where I come from so that you understand my answer here. Okay? Ruth, if everything's going good, you feel good, don't reheat your food, or as little as possible, okay? You don't want to throw food out, right? So don't throw it out. In a perfect world, you never do it. But we don't live in a perfect world, and look at the cost of food today. Just go to the grocery store. It gives me a migraine, the amount of money. I often wonder, how does a family do it today? And I don't care if you're in Canada or United States. Man, it's expensive going to the grocery store. You see the price of steak and everything is crazy. I get that. So, Ruth, reheat your food, preferably not in the microwave. But again, let me give you my overarching principle when it comes to this. If you're in the 93% that have metabolic syndrome and you're out of whack, get the big picture first. Turn the ship around. Get on the reset. Start eating better than you are. Get the big picture. Like I used to say, don't rearrange the deck chairs on the Titanic. Don't worry about that right now. Okay, so that's my overarching principle. I never overwhelmed a patient that came in and they were out of whack. I did all their blood tests. I did all their testing and I go, okay, you got problems. Let's start with the basics. And when you get down the road, you can start, looking for everything that is completely natural, organic if you can afford it, and all this and that and the other thing. You know what I'm saying? And then when I talked on the radio for 20 years on my radio show, and now how many years in my podcasting, I say the same things. Focus on the big things first. Avoid the iceberg. Do the big things first. Change your diet. Don't worry about if it's 100% organic. Don't worry about that. Okay? You can worry about that later. Anyway, you see where I'm coming from? Okay? See where I'm coming from? Reheat in a frying pan. Who said that? Yes. I love it. Okay, thanks, Ruth. It's a good question, okay? Do they change their molecular structure? Nah, like I said, enzymes more than anything. If you overheat stuff, you lose some of those. No. Okay, I wouldn't worry about it. Daphne wants to know what her cortisol should be, the number. I don't care. Daphne, it's one thing. Listen, I used to test for it, okay? I used to test cortisol in my office. But I didn't never, ever test cortisol without first looking at, you came to my office You filled out a questionnaire. And there was a very important reason for that, because I wanted to know what your symptoms are. I didn't rely on blood work. I didn't rely on it. Not that I didn't look at it. I didn't, cortisol is one of those things that can be finicky. I've seen it where cortisol was normal in my office. By the way, I used to do urinary cortisol. To me, that was the best one, not the blood cortisol. Okay? But it doesn't matter what the number is, because I saw it so many times that the cortisol wasn't too bad, but their symptoms of cortisol were through the roof. Okay? So what did I do in my clinic? You know what? Your cortisol's out of whack. They go, well, I thought you said the test was normal. Yeah, but your symptoms trump the lab. It's like thyroid. Your symptoms trump the lab. I don't know how many thousands of people, their thyroid numbers were normal. And yet they had all the symptoms of thyroid issues, and usually with cortisol too. So you see what I do? I said, nah, the old-fashioned doctor, if it walks like a duck and talks like a duck, it's a duck. And I was trained like that. So for me, it's not that I don't look. We used to do biomarker testing, where you could send your dry blood, saliva, urine into the clinic, and we'd put it through the lab. But I would not give results to anyone unless with their blood work, they sent in their questionnaire. Because your history and what you're feeling and all that, super, super important, guys. So Dad, it depends. You're asking what your cortisol should be. What number? The blood? The saliva? The urine? And I don't care. So don't you care? How do you feel? How do you feel? That's really more important to me when it comes to cortisol, even your thyroid. I'll look at the numbers, but nope. Sherry is saying to recommend her, John before Sherry. I'll miss it, and then they're going to be mad at me. John, how much coffee is too much? Never. No, look. Coffee is not, first of all, coffee is not a diuretic. But I want to tell you about all the research, and it's pretty well documented. The best research is showing that the sweet spot for coffee is 4 cups of coffee a day. It's the sweet spot. It's like me telling you, John, because I get asked this 10,000 times a year. How much water should I drink? Well, 2 liters. It's the sweet spot. Science is showing it. And I knew it. And I seen it. And so 2 liters, 64 ounces. 4 coffee, 4 cups. 8-ounce cups, I guess. I don't know. 32 ounces of coffee. If you have 5, is it going to kill you? Nope. Okay? Because I've debunked that. The coffee is a diuretic. It ain't a diuretic, okay? I don't know how many people, and I still get it. Well, it's a diuretic. You lose all your minerals, and you got to have 1 cup of water. You got to have a cup of water for every cup of coffee you drink. Nah, Nah. I want you to drink water. You get on the reset, drink water and drink coffee. Got it? Dr. Martin, I don't like coffee. Well, I feel sorry for you. You're missing out on the real vitamin C. But thanks for the question. If you have 6, John, and you feel good, enjoy. Okay? But I'm telling you, the research is in that area of 4. And you know, I've been saying this for... Guys, I started talking about coffee when I graduated, 1974. And it's acidic, it's no good for you, it'll kill you, it's terrible, and you never want to give that to anyone, and you guys got a bad habit, said the tea drinkers. Okay. Nah, it's good for you. Thanks, John. Sherry, my chiropractor recommends chlorella. Yeah, look, and I like chlorella. You know, it's algae. It's good protein. It's spirulina. You know, I like spirulina. Okay, it's a good detox. Chlorella. Yeah, I like it. What do I think of it? Yeah, it's good for you. I got no problem with chlorella. Okay? Green. Okay? Yeah, it's an algae. Different than spirulina, but they're both good. Okay? They're both good. I used a little bit of spirulina sometimes in my office. I liked it for more for doing a detox for heavy metals. Okay? But I found probiotic to be better for that with L. reuteri and L. rhamnosus. I found that, okay? But I like it. I do like it, okay? Tell your chiropractor, hey, good for you. I got no issue with it. Teresa, what causes CRP to be high, homocysteine to be high, and I'm on a very low carb diet for many months now, and my lipids are good, which is good, but my A1C is still high at 6.1. Well, Teresa, you're still in the reset. Okay? Your body you're doing all right. Okay? And CRP, yep, it's high. Your homocysteine is high. Check your B12, okay? Tell me if that's good. Because that has a big effect on homocysteine. Okay? And you have inflammation in your body, Teresa. And I don't have your full history in front of me for me to give you a better answer than this, but to tell you, if you're eating right, keep going. Now, just the fact that you got your A1C is high, you better stick to it. Low carbs. When your A1C is 6.1, okay, let me tell you something, Teresa. You and carbs don't get along. So just put that in your craw. Just put it in your DNA and go, yeah, that's me. Okay, don't look at other people. Just look at you and say, hey, your numbers don't lie when it comes to A1C. It's just who you are. And I'm not saying that 6.1 A1C is good, because it's not. But don't give up. And don't be discouraged either. A lot of people get discouraged. It's what's the use? Hey, every little bit that you do is going to help you. And you might have had inflammation for 20 years. I don't know. But if your CRP, C-reactive protein, is high, don't stop. Everything anti-inflammatory. And I would have you on high DHA for your CRP, okay? And curcumin for your CRP. And Navital for CRP. Now, you're also saying that your, here, what was high? Oh yeah, your homocysteine. That's B12 usually. Okay? That's your B12. So just check that. Send me info at Martin Clinic. Give me your numbers and say, hey, it's Teresa. You talked about my A1C and my CRP and my homocysteine numbers. But don't give up. Don't give up, Teresa. Okay? It's all right. If you're doing all right, and is there such a thing as a pancreas burnout? Yeah, well, that's called diabetes. That's a pancreas burnout. But again, I have had type 2 diabetics reversed. When they found out they had an allergy to carbs, crappy carbs, they had an allergy to them. So you don't get along. What can I tell you? Don't shoot the messenger. I'm on your side. You're a type 2 diabetic, you have an allergy to carbohydrates. It's as simple as that. So you and carbs don't get along, don't eat them. Okay? Okay. That was Teresa, thank you. Liz, how much oil of oregano would you take if you had an yeast overgrowth? Okay, well, look, I mean, can I tell you what I do? Okay? Every day I use oil of oregano. Okay? Every day. Well, I use it double because we have oil of oregano in our digestive enzyme. But our specific oil of oregano, okay? I'm going to boast a little bit because if there's anyone that knows more about oil of oregano than me, I'd like to meet him. Or her. Okay? Oil of oregano owes me money. Okay? Because I've been talking about it for 40 years. And how good it is. And how much I love it. So how much? Well, you'll probably get better answers, Liz, from the scroll. Because everybody on the scroll just about takes oil of oregano. And they have different ways of doing it. I brush my teeth with it. I put a couple of drops on my toothbrush. And brush the gums. It goes into your bloodstream. You can put a couple of drops in your tongue. Under your tongue, you can dilute it. You want to put some water, dilute the oil of oregano. You can gargle with it because it don't kill your friendly bacteria. Isn't that beautiful? Imagine a natural antibiotic that don't kill your friendly bacteria. That's oil of oregano. We put it in our digestive enzyme, and no one does this, but we do. Why do we do it? Well, because we're going after SIFO, small intestinal fungal overgrowth, which is a big problem today. Okay? It's a big problem today. And Liz, if you have an overgrowth, you might have an overgrowth even in your small intestine. But you can take it any way you can take it. Is it going to kill you? No. No, it's good for you. How much? I don't know. Can you take too much? Well, if you get stomach problems, because oil of oregano is strong. It's like Buckley's, right? It tastes bad, but it works. I think they stole that from me. Oil of oregano. Love it. Okay. Does our hormone, Sandra is asking, does our hormone supplement, menopausal supplement increase progesterone? Yep, that's why we made it. It decreases your estrogen and increases your, because we dim it out. We try and dim the extra estrogen, okay? Remember, you need estrogen, but you don't need the xenoestrogens in your body, and you're surrounded by it, ladies. That's why our menopausal formula dims it out. Okay? It dims it out. Plus, it elevates the progesterone. You love progesterone. Okay? It elevates it. I have men on this thing for their prostate. Dimming the estrogen. And if it gives a man more progesterone, who cares? Anywho. And Sandra's got spinal osteoporosis. Well, get strong. No supplement is going to replace getting your muscles stronger, Sandra. Get your muscles stronger, okay? That's really important because they anchor into the bone and the bone builds by muscle. And you need vitamin D, big time, with K2, okay? Make sure you're getting those. That was Sandra, and thank you very much. Yes, and progesterone does help bone health. It sure does. Jolanta. How are you, Jolanta? My doctor is recommending I have a mammogram. What does Dr. Martin think? Well, look, this is for educational purposes only, okay? Just understand that. I am not giving you, Jolanta, medical advice for you. This is general because you're into an area that I used to do this with patients, by the way. Okay? You were in my clinic and you asked me about a mammogram. Okay? I said, here's what I would do. This is for educational purposes only. There are two schools of thought. Okay? One school says mammograms are for prevention. Well, no, they're not. They're for detection. Okay? And that school says that's the most important thing. You gotta detect cancer early. The earlier, the better. So that's a big school. It's the broad road that most doctors, from oncologists to doctors of all kinds, believe in that. There's another school. It's a narrow one. It's on the narrow road that says mammograms have an enormous amount of radiation to them. One. And this narrow road says mammograms lead to many false positives. They see something on a mammogram, now they want to do a biopsy. And it leads to a lot of false positives. And, you start down the road. And by the way, on a biopsy, again, you got two schools. You got two schools. You got the big school that said biopsy, it's really important. We got to find that cancer early. And then there's a narrow thing, a narrow road on biopsy said, well, first of all, if something is encapsulated, if a cancer is encapsulated, if a tumor is encapsulated, leave it alone. Your body is dealing with it because it's encapsulated it. So you have two schools. Do you understand where I'm coming from? Okay? I just gave you education. Now, one of the things that I used to do in my office, okay, is use imaging to detect estrogen. Because cancer cannot grow without estrogen. So there's thermography that detects heat. And I had a very specific scan that detected estrogen. You could see it in a man or a woman. And I used to work on getting that estrogen down. because it's a growth hormone. And then, of course, we tested insulin and insulin resistance, which is a big factor. So I'm just saying, okay, you got two schools, you have to understand that. And the more you're educated, the more you can make a decision. I can't make it for you. Even in practice, I was very careful not to make a decision for a patient when it came to mammograms or getting a biopsy or, for men with their prostate. They'd ask me, Doc, should I get a biopsy done? I gave information, both sides. Here's why they want to do it. Here's the other side. It's a small side, okay? But anyway, just understand it's for educational purposes because I can't be your doctor. And even when I said, well, I'm going to give you information. You decide. Okay. That was Jolanta, and thank you very much. Oh, gee, I didn't know what time it was. Okay, one more question, we're out. It's on, Wendy is talking about the appendix. Dr. Martin, can you talk about it? Well, I have talked about it. Years ago, okay, they took your appendix out, and sometimes you have no choice. But the thinking was, just like your tonsils, okay, it was part of the evolution and you didn't need it anymore. The appendix was an attachment to your bowel. Who needs it? Your tonsils. You don't need tonsils. Get rid of them. And I was mad at my dad because he wouldn't let me get my tonsils out. Everybody else in the class, I think it was in grade 6 or I can't even remember what year it was, they had their tonsils out. And they got ice cream at the hospital. And I said, I want ice cream, a Dixie. They give you a Dixie cup. He said, you need your tonsils. Shut up. That was my dad. He was smart. He said, you need your tonsils. It went against the grain. Because everybody on tonsils. And appendix, same thing. You don't need it. It's evolutionary. In 10 million years, men won't have it, tonsils anymore. Appendix, I mean. So, but now you know what they know, and I'll close with this. And I did a study here, I can't remember how long ago. The appendix, it's a reservoir for microbiome. It saves your good bacteria inside of it. And when you need it, it pours it out back into the gut. Did you know that? Oh, it's not evolutionary. You need it. Yeah. My dad was right. Okay. Gotta go. Okay, we love you guys. We got a great week coming up. Talk to you soon.